So as you can see, initially there has to be a primary referrer to a surgeon. So that often is a general practitioner. Sometimes it can be an emergency specialist or say a physician on the ward who feels a patient is developing a surgical problem. And the patient then is referred for a surgical review. Now we realised through discussing this that at the same time as a patient is being reviewed to see whether or not a surgical procedure is appropriate, ideally a risk assessment should be undertaken to be able to work out whether or not proceeding with surgery is in the best interest of the patient in terms of a risk-benefit analysis. And this can be done by the surgeon, or it may be done by a perioperative medical specialist, may be done by our very experienced nursing staff who are skilled in this area as well. But at the end of that process, what happens is there is either a decision that a patient should have surgery or that they may not be a surgical candidate. If a decision is made not to perform surgery, then the patient needs to be referred back to the primary referrer and then given a management plan that helps them manage their symptoms or their life expectancy so that the patient isn't left in the lurch, and that's really important. However, most patients do proceed with surgery.